So why do chiropractors measure blood pressure? Well, it's because if your blood pressure is too high, you have an increased risk of heart attack, an increased risk of stroke, an increased risk of kidney disease, and an increased risk of death. Now, we want our patients to live long and healthy lives, and so it makes sense to measure blood pressure, and if it is high, to reduce it. So what should our blood pressure be? Well, I was reading a publication by the American Medical Association. It was put out in 2014, and it was an evidence-based guideline for the management of high blood pressure in adults. So the American Medical Association say that the pressure in between heartbeats, the resting pressure, should be less than 90. When the heart beats, of course, the pressure rises, and if you're below 60 years of age, the pressure shouldn't rise above 140. For those people over 60, the blood pressure when the heart's contracting shouldn't rise above 150. So for those of us who are under 60, the blood pressure should be below 140 over 90. For those over 60, the blood pressure should not be above 150 over 90. So what should we do about it if our blood pressure is high? Now, of course, medication plays a huge part in the management of high blood pressure, but what was really interesting, I thought, in the conclusion of the paper by the American Medical Association was that the potential of three things cannot be overemphasized. Firstly, a healthy diet. Secondly, weight control. And thirdly, regular exercise. And what the American Medical Association say is that these lifestyle treatments have the potential to both improve blood pressure control and to reduce medication needs. So that's why we measure your blood pressure. We want you to live a long and healthy life.